Good morning. This hearing will come to order. It's nice to see the reunion of two good friends, two individuals who have really done working together some pretty extraordinary work with a pretty simple concept, pretty simple idea of let's get some information on the federal government. Coming from a manufacturing background, certainly it just is in my DNA, root cause analysis, trying to find areas of agreement, continuous improvement. And from my standpoint, that's what this duplication report has been all about. The history of it is really quite interesting. I'll let Dr. Coburn really tell the history of that. I don't want to steal either of your thunder. But I think it's been remarkable is this simple concept that is just basic to business, having information, measuring results, was pretty foreign to the federal government. And once implemented, it's having some dramatic results. And of course, it was also carried out in a completely bipartisan fashion, which is what this committee is all about. But again, without stealing too much thunder, the duplication report over the last 5 years has saved the federal government about $56 billion. If the programs that are currently being implemented over the next 10 years, you're estimating it'll save about $69 billion additionally. 34 of your recommendations have been partially implemented, 20% have been unaddressed. So if those are fully implemented and addressed, who knows how many additional billions of dollars can be saved. So, I mean, my hat's off to both of you gentlemen for really doing the hard work of doing the oversight, developing the reports, getting the information the government truly needs if we're going to really solve these problems. I'll have some other things to say. I've got the opening statement that I'll ask to be read for the record, but what I'd rather do, because we're going to be broken up, this hearing will be suspended for votes at noon. I'd rather just get into your testimony and then wait for Senator Carper for his opening statement and for questions. So it is a tradition of this committee to swear the witnesses in, so if you both rise and raise your right hand. Do you swear the testimony you will give before this committee will be the truth, the whole truth, and nothing but the truth, so help you God? Please be seated. So, Tom, let me start asking some questions just in terms of, the duplication report, from my standpoint, started a process. I'm from manufacturing. In order to have a good product, you have to have a good process. And we can describe that in greater detail, but I want to go back to what you're talking about in terms of forcing change. About a constitutional amendment that will force the change. I mean, that's a process that we have to put in place before Congress is going to act. Just kind of speak to that point a little bit, if you would.
Well, I guess that's one of the things the American people are asking, quite frankly, is you have an oath. Why do we have to have a constitutional amendment for Congress to do what's best for the country? And they have decided that Congress can't do what's best for the country, so they're going to do it themselves under the Constitution. In other words, the Constitution actually is the powerful tool with which to solve the problem of our country. It's big enough to solve the problem. And the partisanship and the politics kind of move away when we start saying, why do we want a balanced budget? Is there a reason? Can we have it? In other words, is it impossible to look at mandatory spending today, discretionary spending today, and what our needs are for our country and get to a balanced budget? And the answer is absolutely not. It's absolutely not. If you actually go in and look at where things are. The question is, in my mind, and my advice to the committee is, look at the roles that the federal government has taken over that should be better and more efficiently done at the state level. Because you will find you can get the same results for a whole lot less money and have all sorts of different better results than when the federal government's doing it. Now, I know I'm a small government advocate, and I can understand that could be poo-pooed up here, but when you just test it and look at how things work and you look around the states, that's obviously true.
But a big part of the problem, and you know this, is that 2/3 of the federal budget is on automatic pilot. It's in law. It's if you qualify for benefits, you get them. We keep expanding the eligibility. And so unless you are able to pass another law, and that's what's been impossible to do here, to actually rein in, first of all, put everything on budget, put it in an appropriation process, so every year you have to actually vote on all the appropriations. That's not happening today.
Well, I think there's two
part of the reason you need some kind of process constraint to force those laws to be changed.
Well, for example, As a Social Security recipient, I get an increase when there's a certain amount of inflation. Where's the tax dollars to pay for that? So what ought to happen is that if we're going to continue to have the kind of benefits that we have, and we're not going to change the programs, at least we ought to provide the revenue source to pay for them. The second thing is, and Gene mentioned this in his talk, in terms of disability. There's no doubt in my mind, 100% sure that 1 out of every 3 people collecting disability in this country are not disabled. And yet, when they make an error, they forgive the money rather than asking for it back, or a congressman goes over and jawbones because he controls the Social Security's budget and says, no, you will keep them on it until you prove they're not. But that just shows you where oversight is, because that started in this committee with Carl Levin and myself, and we did an oversight. Those 3 key actors in that have now been indicted by a federal grand jury, and I presume will go to jail and spend a long time there. The question is did we learn anything from that? Did we change Social Security management? No. So you have the oversight, but if you don't act on the oversight, you have not accomplished anything.
And that's my point, is we're going to have to put the processes in place to force action, otherwise we don't act. Gene, you talked about, some of these things have been implemented. Give us the best example of an implementation of your recommendation and how it occurred, so we can learn from that best practice example.
We in the first year, we identified the fact that there was duplication between the ethanol tax credit that was in place and the renewable fuel standards, and we didn't need the ethanol tax credit anymore, and Congress let that expire. I mean, that was a big change. I mean, people have been advocating that for a long time. After 9/11, the airlines and the traveling public were supposed to pay for the increased security, but Congress capped the fees. We had an open recommendation for 6-7 years that Congress then go to the fees rather than have the general taxpayers or have Congress borrow the money. That was passed, and that's about $44 billion saved there. Same thing with direct payments to farmers and that program. But I would just say on the fiscal condition, we're on an unsustainable fiscal path. Every part of the federal budget, mandatory spending, discretionary, and needs to be looked at, and the revenue side of government and tax expenditures. The one thing, we also have a very ineffective way, which is to control our debt. The debt ceiling right now is totally after the fact. We've already authorized all the spending. It just authorizes the money. I've recommended we change that. And Congress ought to have some reasonable limit as a percent of gross domestic product that's going to control our debt. Unless we do that, you're going to have problems, and the interest rates are going to continue to climb, and the service costs on that debt are going to skyrocket. The only thing that's been saving us so far is low interest rates and borrowing an incredible amount of money.
So kind of lesson I'm learning from the examples you threw out there is, first of all, you have to highlight it and get the public to be aware of it to really force the politicians, the elected officials, to actually act on it. Because if you don't shine the light of day on it, nobody's going to know, and this place is going to just continue on automatic pilot. Let me, in my last moments here, talk a little bit about one piece of legislation we're trying to put together that Leader McConnell is completely supportive of. It's actually 15 bills, maybe 16 bills, that have broad bipartisan support, generally based on GAO's recommendations. Things that have been passed through our committee unanimously in a bipartisan fashion. I mean, I could list off the co-sponsors, but just about, I know every senator on this committee has supported these. I know a lot of members of the Senate have supported these pieces of legislation. So, hopefully we can get bipartisan support. This is something we have not been able to pass these through unanimous consent. Some of you would object. This is something that can actually get floor time, so I'm certainly hoping that Senator Carper will be supportive of. We haven't given it a name yet. We don't have the right acronym, but it's really a group of 15, maybe 16 pieces of legislation that implement the recommendations of GAO. It's good governance. It's moving. It's continuous improvement. It's not a be-all, end-all. It's not going to solve the entire problem, but just like the duplication report, you start here and you start making progress. And again, that's just kind of my manufacturing background. I'll work toward continuous improvement. Do it over enough years, pretty soon you look back and go, hey, we made some real progress. with that to center spending restraint. In the fiscal cliff deal, we got about $700 billion of revenue, so that's about $3.8 billion. That was about 81% of Simpson Bowles. We did no mandatory spending whatsoever, but it unfortunately barely made a dent, because according to Congressional Budget Office, the projected deficit over the next 30 years, which was a concept I kind of came up with in working with the White House right after President Obama got reelected, the total deficit over the next 30 years, which really is the definition of the problem, the demographic bubble, all the baby boom generation retiring, all these promises made, got no way to pay for them, is $103 trillion.
More.
$103 trillion. This is with what we've already done, 80-some% of Simpson Bowles. $10 trillion the first decade, $28 trillion the second, $65 trillion the third. Now here's the problem. I was in the White House. President Obama joined us for the second half of a 2-hour meeting. And I slid my 30-year deficit chart under his nose, and I said, Mr. President, I've given my PowerPoint presentation to 17,000 Wisconsinites and audiences about this large. But you're the president, you're the bully pulpit. Please use it. Take the American public the truth. Show them the depth of the problem so that collectively we can take the first step in solving any problem. You know what he said to me? He said, Ron, we can't show the American public numbers this big. If we do, they'll get scared, give up hope. He said, besides, Ron, we can't do all the work. We have to leave some work for future presidents, future Congresses. So it's that denying of reality, that lack of the lack of willingness to tell the American people the truth, that lack of transparency that is preventing us from really addressing these very serious problems. 2 quotes. We talked about Jefferson. Let me say paraphrases because I don't have them in front of me. Thomas Jefferson said, a nation that expects to be free and ignorant, living in a state of civilization, expects what never was and what never will be. And he also said, a government big enough to give you everything you want is big enough to take away everything you have. And those are realities we're dealing with. Gene, I want to talk to you a little bit about fraud. We talked about waste, which is really kind of what I put the duplicated programs in, just waste. If we're doing the same thing in different agencies, not doing them well, not measuring the results, that's waste. Let's talk about fraud. Earned income tax credit. We've got excellent inspector generals doing reports showing 23.8% is the most recent figure of fraud in the earned income tax credit. We don't have very good information on fraud in other programs. I know people estimate. I've gotten in trouble kind of estimating it. We need that information. Can you just kind of talk a little bit about what the GAO, what inspector generals can do to really ferret out fraud in, you pick the program?
Well, first, one of the things that we found lacking was attention to the fraud issue and building it into program management. So we created a fraud risk framework, or fraud prevention framework that agencies should use to focus on what are the risks of fraud, what are we doing about it, how can we measure it. Same way in improper payments. Before we started doing financial audits in the federal government, nobody was measuring improper payments. So you need to focus on this. It's the same way we did with the improper payments and get, Congress then passed legislation. GAO first worked with the IGs, and we were the first ones to estimate improper payments in the agencies. So we've got this fraud risk framework. It's part of the legislative package that you're talking about passing. So I would encourage you to pass that, to put that framework in place at the agencies. Then we need to work with the agencies to have better controls that are in place. We went in and looked at, there's a lot of fraud in healthcare programs, and we went in and looked at fraud cases that were, where convictions were held and the fraud was found and determined by the courts. And we found in 40% of the cases, it was people for billing for services that were never provided, or they were billing for services and charging a higher rate than the services they actually did provide. This is the reason why you have improper payments. So, and the agencies are saying, well, there's not documentation, it's documentation problem. When you have known fraud in that area and there's missing documentation, you've asked for it 4 or 5 times before you determine it's not there, you have to further investigate the fraud area. So there needs to be more attention to it. You need a framework in place. Congress has that now that we've given it to them. They pass that, put it in legislation, I think you'll see a lot of changes. But we need the agency's participation. The problem is too difficult for just the GAO and the IGs to work on. So we need their Congress to hold their feet to the fire as well.
Can you talk specifically, though? So you have the Inspector General of IRS, basically. doing a pretty good study showing and giving us a macro number on earned income tax credit, which is a powerful piece of information we can use to prompt reform. The problem is these other instances of fraud, they are anecdotal. And so certainly when I've used the anecdotes, well, yeah, but it's nowhere near 20% or whatever. How do we turn those micro anecdotes into the macro numbers that really will drive action, that will actually force action, that will create the political will to force action here in Congress? Either you or Tom could answer that one, or if you have any thoughts on it.
Well, I'd comment first on Medicare and Medicaid fraud. They're designed to be defrauded. I mean, think about it. You're fixing the wrong problem. What you have to do is change the design of the Medicare and Medicaid programs where they're not susceptible to fraud. Otherwise, you're going to end up with a bureaucrat in every office and every medical facility if you really want to get it right. Because the program's based on integrity of doing the right thing, and now we're spending all this money to try to find out those who aren't doing the right thing. So the potential is you could spend more money trying to prevent spending wrong money than you would ever save. So you end up spending more money. So my first answer is always try to fix the real disease, not the symptoms. The fraud on Medicare is because the way the system's set up, it's designed to be defrauded.
So being a doctor yourself, being a provider, describe the difference between private sector health care and the level of fraud and what controls are in place there versus Medicare.
Real easy. Blue Cross Blue Shield knows everything about every patient I do. They know my practice patterns. They know my reimbursement patterns. They know when I see a patient, they have computer algorithms. They know what's going on. Medicare doesn't have us. They have no idea. So what Blue Cross Blue Shield and all the rest of the insurance, every provider, they know what their parameters are. And when they see something pop out of the parameter, you know what the first thing they do is? We're not paying this, send us information. So and no human touches that. That's a computer program that sends an email to my office that says, we're not paying this because this doesn't smell right.
So these solutions exist. I mean,
Yeah.
in so many of these problems. I mean, this is just one example. Use that as an example. These solutions exist in the private sector. I mean, they're just table stakes. In the private sector, this is how things operate, but it's just been impossible to implement these things that already exist and have them implemented in government. And as a result, we're paying we're paying billions of dollars in fraud.
Well, these are what Dr. Coburn just mentioned are two of our outstanding recommendations based on this work. One is to have a physician profiling, which is what Dr. Coburn's talking about, and that CMS have something in place. They've started down that path, but they need to do much, much more. The other thing is to require the contractors to have parameters for billing issues that pop up that are out of the normal billing patterns, and they don't even have that. That's an open recommendation, including where people are billing for similar services twice on the same day. And so we've tried to, our recommendations try to take some of the private sector best practices and try to have them implemented in the government setting, but they're too slow to be put in place.
So I'm over time, but I'll just ask rhetorical questions. So why doesn't the head of HHS or Medicare go to the private sector and say, just implement this here? I mean, it drives me nuts. Senator Langford.
Just as a side, it was offered to them for free. They didn't take it. Just let you know that.
By the way, we're also 15, 16, 17 years further away from this baby boom bubble with all these entitlements, which has been pretty obvious and people just ignored it. By the way, Senator Coburn, I like your root cause analysis in the tax system. Rather than try and fix the symptom, which is a complex system, and try and figure out how to get people to prepare taxes properly under a complex system, simplify the system. Scrap it, set up something, I always say, elegantly simple. Two basic principles: raise the revenue we need, do no economic harm. Stop trying to socially, economically engineer through the tax code. We do a terrible job. But anyway, there's my pontificating, I guess. I want to thank both of you. I mean, you have laid the groundwork, your efforts, for this committee to actually do some action, enact that continuous improvement. And by the way, we are getting some results. People don't realize that, but using an approach, that certainly, Tom, you were certainly engaged in, trying to find areas of agreement that unify us, you can actually get results. We've passed 69 pieces of legislation through this committee, most of it unanimously. 24 now have been signed into law. There's another piece of legislation that's waiting on the President's desk. In some way, shape, or form, we've got it to the President's desk, got the result. And I really do hope that Senator Carper will join me in this piece of legislation we'd like to get on the floor, because nobody, again, not one senator can hold it up if we get it on the floor. Senator McConnell's committed to doing so. So we can actually implement some of these great recommendations from GAO. So I hope you join us in that.
Let me just say, if I could, Mr. Chairman, I think we've done good work. I'm proud of what we've done, building on the record of that Dr. Coburn helped to create. And I'm very much interested in the package that puts together a lot of the stuff that I helped to write or authored. The other thing I'm really interested in doing, as you know, is taking up and legislating on postal reform. And I want to get that done. We need to get that done. It's eminently fixable. Dr. Coburn and I tried very hard to fix it, and that's something we should do.
Yep.
And I think we can do both, and we need to.
And we're working with you in the House to try and accomplish something there. But again, gentlemen, thank you for everything you've done for your country, for this committee, coming here today for testifying. You're great Americans. And with that, I think I've got to read the magic words here. There we go. This hearing record will remain open for 15 days until May 12th at 5 p.m. for the submission of statements and questions for the record. This hearing is adjourned.